Today, I want to talk about elder abuse because it happens a lot. Research across more than 50 studies in 28 different countries suggested that about 1 in 6 older adults experience some form of abuse each year. And that means globally, we're talking about roughly 141 million older adults. And those are just the cases that we know about. Most experts believe that the real number is much higher because elder abuse is one of the most underreported forms of violence. People often depend on the person hurting them, they're afraid of retaliation, or they simply just don't know how to report it. And this is important because the elderly are becoming the fastest growing demographic in the United States. So in 2010, about 40 million Americans were 65 years of age and older, and they made up roughly about 13% of the United States. But in 2020, that number grew to 56 million, which makes up about 17% of the population. And projections estimate that by 2030, 1 in 5 Americans, so about 20%, are going to be older than 65 years of age. On top of that, life expectancy is also increasing. Babies live to be real old now, like beyond age 78, which is 2 years longer than the life expectancy 20 years ago and 9 years longer than the life expectancy in 1900. So this burgeoning population of older Americans combined with living longer is just going to place way more strain on our already overburdened social services. And the justice system will also need to become more responsive to the complexity of issues that involve older persons. So training is going to be key because without it, victims are going to stay trapped in harmful situations, the abuse is going to escalate, and the health consequences can be devastating. Studies clearly show that elder abuse victims have significantly higher rates of depression, hospitalization, disabilities. So let's talk about it. What is elder maltreatment? What does it look like? Who's most at risk? Why does it happen? And how do we spot it before things get worse? Elder maltreatment means harming or putting an older adult at risk of harm within a relationship where trust is expected. That relationship could be a family member, caregivers, a neighbor, a friend, or a professional that is responsible for their care. And behaviorally, it looks like physical, emotional abuse, financial abuse, sexual exploitation, and neglect. Legally, in Colorado, elder abuse is acts or failures to act that harm someone who is over the age of 70 years old. And that law covers physical abuse, emotional abuse, sexual abuse, financial exploitation, and Colorado also requires mandated reporters like healthcare workers, law enforcement to report suspected abuse within 24 hours. And if someone is convicted of a crime in Colorado, it can be charged as a misdemeanor or felony, depending on the severity, as a sentencing enhancement. So this just isn't a social problem, it's actually a criminal offense. When people imagine elder abuse, they often picture some terrible nursing home where the staff are like wicked mean to the patients. And while this happens, research suggests that most elder abuse actually happens in private homes by family members, usually in situations where the older adult depends on someone else for care, such as the adult child living with them, their spouse or partner if they're still alive, a caregiver, or somebody who is managing the finances. And that dependency is key because the more someone depends on another person for food, medication, mobility, finances, the greater that there's going to be a power imbalance. And power imbalances are what creates opportunities for abuse to happen. I hate this topic because, like, why would anyone want to hurt sweet old Martha? Well, aging brings a combination of different changes from the biology, emotional, social changes, all of which coalesce and create reliance on others. And when dependence increases, so does the potential for stress, burnout, and exploitation. So as we age, we start to develop physical and health changes because our bodies naturally change. So not everyone is going to experience the same issues, but many older adults deal with worsening vision or hearing, slower reaction times. They develop conditions like arthritis or bone diseases like osteoporosis, also cardiovascular changes that can affect blood pressure and balance. And as a result, the medication can also create additional, like for example, blood pressure medication that can cause dizziness when someone stands up too quickly, Anxiety medications can cause confusion or drowsiness, and even like over-the-counter medications like Benadryl or Tylenol PM can lead to confusion and the increase for falling. So when an older adult appears unsteady or forgetful, it may not be because of cognitive decline, it may be because of medication or normal physiological changes. In addition to physical and health, there's also changes in functional limitations and dependency on others. And as our health changes, daily tasks can become more difficult. Research shows around 40% of older adults have some type of functional limitation, including things like being able to go shopping, managing their own money, cooking, taking medications, and even getting around. And 14% have difficulty with tasks needed for independent living, and these are known as instrumental activities of daily living. So about 1/4 of older adults struggle with both these tasks and a basic self-care activity like bathing, dressing, or even using the bathroom. And so when that happens, older adults often need help from family members or caregivers, which can increase dependency on them. And dependency creates those opportunities for exploitation if someone misuses that trust or takes advantage of them thinking that they're going to get away with it because of their cognitive decline. Speaking of which, cognitive changes like dementia or memory problems are another huge risk factor among older adults. And these conditions can affect someone's ability to even recognize abuse, remember events, be able to manage their finances, be able to take care of themselves, or even report what happened. And that makes individuals with these cognitive impairments especially vulnerable to financial neglect, not only by someone else, but also self neglect, not taking care of themselves, and also psychological abuse. Mental health also plays a really important role. Depression and anxiety are a normal part of aging, but they can often go undiagnosed because, sometimes doctors assume sadness is expected in older ages. As we age, we start to lose our family members and our close friends around us. And so sometimes older adults themselves will even normalize it. And many older adults grow up in generations where mental health was considered taboo. So they may be reluctant to talk about it and afraid of becoming a burden for their families. Additionally, a lot of people have garnered to be strong, independent individuals on their own. And so when you need to rely on someone else, it can create issues with pride and the desire to be independent. And on top of that, when someone becomes dependent on others, we also have to talk about caregiver stress. Many caregivers are family members juggling jobs, children, their own financial pressures. Providing full-time care can be emotionally and physically exhausting, and without support, caregiver burnout can lead to neglect and exploding in the moment and hurting someone that is an older individual out of frustration. This doesn't excuse the abuse, but it helps explain how these situations can develop. And so when you combine things like physical health changes, functional limitations, cognitive declines, emotional challenges, pride and stubbornness, and on top of that, caregiver stress, you begin to see why elder abuse can occur because most cases happen where vulnerability, dependence, and stress intersect. And understanding these dynamics is critical not only for identifying abuse, but for preventing it before serious harm occurs. So, the older adults who are most at risk for elder abuse tend to be those who are socially isolated, particularly from those who could actually potentially intervene if abuse is occurring. Also, among those who are physically frail or financially dependent on someone, those who are experiencing cognitive impairments like dementia. For example, people with dementia are especially vulnerable because they may not remember the abuse clearly, and as a result, others may dismiss their reports. For example, I was in a training where they described how a woman who had early Alzheimer's kept telling staff at a clinic that her nephew was stealing money, and everyone in the facility assumed it was confusion or that she was making, but turns out she was actually right, and he had opened up 3 credit cards in her name and was using them to buy motorcycles, which, if you're wondering, is not medically recommended treatment for Alzheimer's. Very similar to child maltreatment, there are major types of elder abuse. Among the most common is going to be psychological abuse. It's often subtle. Think yelling, threatening, humiliating, treating an adult like a child, isolating them from friends and family. There was a case where a daughter was controlling every aspect of her elderly mother's life. And this was a cultural consideration where much of that pressure fell on the eldest daughter to become the caregiver as the elderly age. But this daughter took it a little bit too far because she was the one who basically regulated everything. So, who the mom could talk to, when and what the mom could eat, when she could leave the house. And like the mother even described it as living on parole because her cognitive abilities and her mobility issue rendered her dependent on the daughter for her care. Some signs of psychological abuse can often include withdrawal. They're becoming much more depressed, but also especially fear around certain people and sudden changes in their personality. And so, if someone seems terrified of a caregiver entering the room, that might be a clue worth paying attention to. Financial exploitation is also incredibly common among older adults. This could look like unauthorized use of their bank accounts or credit cards, pressuring them to change their will so that the child becomes the dependent or power of attorney, stealing and pawning vulnerable items like jewelry, old heirlooms that they have, or someone becoming suddenly very interested in helping with the finances. So here's a classic example. Let's say our neighbor Craig is all of a sudden really interested in helping the older man with everyday activities like grocery shopping. So at first it seems nice, he comes over and starts mowing the lawn, but now it escalates to now he's handling all the finances. He's handling the bank card. Craig starts withdrawing cash. Eventually, the older adult realizes that Craig has been taking hundreds of dollars a week. And the biggest investigative tip in these cases, you want to follow the money. Bank records, unusual withdrawals, sudden financial changes. These are often the smoking gun. Additionally, there's also neglect. And neglect happens when someone who is responsible fails to meet basic needs. That could be not providing medication, not helping someone eat, leaving someone in unsafe conditions. It also includes self-neglect, where an elderly person doesn't have the capabilities of taking care of themselves. And so they don't. I was on a ride along one time where we walked into a home and there's an elderly man with mobility issues who hadn't been bathed in weeks and he had severe bed sores that were infected. Signs of neglect can include things like malnutrition, like the client is losing weight, they're not eating, or sometimes they're forgetting to eat. In fact, dehydration is a huge issue among older adults because they simply forget to drink water. Also, neglect can look like poor hygiene, untreated, such as not taking someone to the doctor out of fear that they're going to get caught for causing the injuries. Also, unsafe housing conditions, such as like broken stairs or not having an adequate ramp for somebody to get in to walk around. And then at times, whether it's out of frustration or a sick need for power and control, physical abuse can also happen among older adults, including hitting, pushing, restraining them, or just handling them roughly. I've seen a ton of cases where the frustrated caregiver slaps or hits an elderly patient who is perceived as being difficult. And so some of the most common red flags are going to be your unexplained bruises, repeated injuries, and stories that change when you ask questions. So similar to child abuse, we want to see if the older adult and the caregiver if their stories are consistent. So ask the older adult and the caregiver separately what happened. If one says, oh, she fell in the bathroom, and then another person saying like, oh no, she rolled off the bed and she hurt herself. And unfortunately, sexual abuse can also be very common yet unreported and underidentified among the elderly. We assume older people become sexually inactive, and that is not the case. Sexual abuse can also occur, particularly among those who have cognitive impairments, where people are going to take advantage of them, knowing that it's going to be challenging for the elderly victim to be able to articulate what happened, identify it as wrong, be able to report it, and or remember details about what happened. Potential signs of sexual abuse among the elderly can include unexpected injuries, particularly in the breast or vaginal area or anus, sudden behavioral changes, or even an elderly individual getting a sexually transmitted infection. So here's also an uncomfortable truth. Most perpetrators are not strangers. In fact, they're usually the adult children or the spouses. Sometimes they can be other relatives, and sometimes it can be caregivers. And often the situation begins with good intention. A family member moves in to help, or the elderly moves in with the family. Financial stress increase, caregiver burnout sets in, and gradually that relationship shifts from something that was supported to now being exploitative. And this is important because elder abuse has serious consequences. Research consistently links elder abuse to higher rates of depression, increased hospitalization, which can be significantly more stressful on finances, but also our public tax dollars, increase in disability, institutionalization in homes or centers, which can also be incredibly expensive, and also increased mortality. In fact, some studies, victims of elder abuse had significantly higher risk of death compared to those who were not abused. And so just think about that. Abuse doesn't just hurt emotionally, it can literally shorten someone's life. And so it's important to remember that elder abuse thrives in silence. It happens when people don't know what to look for, it happens when professionals aren't trained, and it happens when communities assume someone else will step in and take care of it. But the good news is that most elder abuse cases are preventable. When caregivers, professionals, and investigators understand the warning signs, they can intervene early. And sometimes that intervention is the difference between someone living the rest of their life safely or continuing to suffer in silence. So if you take one thing away from this, pay attention, ask questions, and when something feels off, trust your instincts and report it.